gives flexibility to expand or pushes it upward. So here, the next thing you want to see, we can remove the heart. Oh, okay. The next thing you want to see, there are 4 lobes on the right, unlike human that are 3. 1, 2, 3. The 4th one is this one. That belong to that side. Yeah.
Oh, okay.
And here you have 3. Apparently you cut something here. And this is the diaphragm muscle. Beautiful. Very pretty diaphragm. And this is, you have cut 2 lobes apparently, correct?
Yes.
So then if you remove the heart, which we don't need it anymore, correct? Because we have here, remnant of 1 lobe, remnant of 2 lobe, and 3rd lobe. So you did cut 3 lobes, 2 lobes. And then, this is your cat?
Yes.
I like the blood vessel, nicely dissected. Okay, in order to see, so you continue with the trachea. It's easy to follow because trachea is your guide to the bronchus. This is trachea, do you see that? Still I'm following it. And then you go to the root of the lung.
This is the heart. That's
Okay. So do you see? Actually, I start to see it here. If you can clean it up a little bit, you see the 2. Do you see that? Already I can see branching, 1 and 2.
Yes.
However, you need to remove a little bit of these tissues, connect the fat and tissue. Do you see that?
Yes.
It's beautiful.
Can we see over here? Yeah.
That's the primary bronchus.
Okay.
Oh, nice, here. Now I see it really.
So you really have to remove the heart.
Yeah. Here. And the other one. This one. So you can see that the difference between these 2. This is more horizontal. And this is more perpendicular. So if kids swallow something, most likely end up in the right lung then. Do you see the significance of this? And we're going to talk about it in lecture. So right now, all you need to see the primary bronchus. Do you see that? 1 and 2. Do you see this is more perpendicular, this is more horizontal?
Yes.
And actually this is probably a little bit wider too. So having this property, most of the things we swallow end up there.
It's in the brain.
Okay? This is the pulmonary system of, in addition to that, you have in the respiration, simple respiration, normal respiration, diaphragm is critical, and external intercostal muscle, which are here. Do you remember external intercostal and internal intercostal? Those are that over the rib and in between the rib. Those are external, and within the rib they are internal intercostal muscle. So I don't know if that is significant here because it's very easy. This is the, what was this? Sure, it wasn't pectoralis. Because pectoralis was over the chest. So this must be probably latissimus dorsi.
Do you mind if you say it again what's important in the respiratory system?
Yeah.
The cat, just so I could get it.
Okay, so this is really a nice cat. I like it. So here is the thyroid cartilage. This is laryngeal prominence. The thyroid glands are on 2 sides of thyroid cartilage, and this is trachea. This is a C cartilage, which is also called tracheal cartilage. So you have thyroid cartilage and tracheal cartilage, and you have 3 more. Well, you can see it here, okay, on this. You can see it on the model. And then the back of the trachea, the C cartilage, is come together with the help of trachealis muscle, okay, which closes and opens. This is a smooth muscle, by the way. And then the trachea, and in the back is esophagus. And then the trachea diverges into two primary bronchi, left bronchus and right bronchus. And what you need to know also that in cat, right lung has 4 lobes and left one has 3 lobes because one of the lobes compensated for heart, location of heart. And this is called root of hilum. Hilum of the lung is the place where blood vessels enter, nerve blood vessels and everything else enters, called hilum, and root of the lung. So microscopically, this is what you can see in cat, normal. But then for the cartilages, you need to use that tracheal model because there is tracheal cartilage, thyroid cartilage, coracoid cartilage. Then in the back you have coneate cartilage. What is the other two? Arytenoid cartilage. One more. Arytenoid cartilage. Caniculate cartilage. Now, there are 3 pairs and 3 major cartilages. The 3 major cartilages are thyroid, tracheal, and coracoid, right? They're single, but the other 3 are 3 pairs. And if you can see it here in the back, there are 2 on each side, 1 on each side, okay? So that you study the model, and they are very clear there, okay? Anything else?
Thank you.
So the anatomy of the nose, we're going to study in the lecture. You have to use images because